Welcome to our pad, where Dr. Jin and I go more than skin deep on topics of interest to our patients here at Premier Aesthetic Dermatology. And Dr. Jin, today I would love to ask you about your approach to pigmentation.
Pigmentation is big. There are lots of different types of pigmentation. In our office, we see pigmentation from the sun, which we call photo damage or sun damage. It could be ranging from anywhere from little freckles to big round sunspots. And then we have pigmentation from hormones, what we call melasma, and we see that more in more ethnic or darker skin. And then you could have other types of pigmentation. So pigmentation is a big topic that we can definitely talk about.
So, what's your approach to a patient like me coming in with just freckles and sunspots as I'm getting older?
You are like my favorite type of patient. Dr. Erin is a redhead. She has the type of skin that we can treat with all type of lasers, and I'm not worried about is she going to get a side effect. She has a lot of little freckles. She has beautiful skin because she's been treating it for years, but she's a little bit more prone to the sun damage that I talked about. So freckling probably was something you got a lot of growing up. Number one thing is because we know it's from the sun, you have to be very good about sun protection. I think that no
Absolutely.
matter how many lasers we do on you, if you're not good about that, then it's just going to come right back.
I call that protecting your investment when you get a really good sunscreen after a laser treatment.
Exactly.
What lasers would you recommend for me?
So I think to start off, some basic lasers, like I love the IPL or photofacial for you. I think that's like the workhorse for a lot of people with sun damage and your type of skin. If people wanted to just maintain that, sometimes we would even do a clear and brilliant laser. Really wanted to do a little bit more aggressive. Sometimes you could do some more resurfacing lasers. What have you done for your photo damage?
I have been doing IPL routinely for over 10 years. I think it's just a great way of reversing some of the sun damage and freckling that I get, even though I am really good about sunscreen. I have gone a little more intensive with our combined IPL and non ablative fractional resurfacing, getting a little deeper into the collagen. Recently, I've been interested in trying our Pico laser. Now, that's a laser we use maybe on patients with more Asian skin or darker skin types. Tell me a little bit about the Pico.
An IPL or a photofacial is not a true laser. It's a broad spectrum wavelength, so it can target a lot of different things. Whereas the Pico or some of the other true lasers have a certain wavelength that will target the brown. People who have just a few sunspots or dark sunspots on their face or their hands, sometimes we may want to do the Pico. Or another laser that we have in the office is the med light.
I like the Pico when I have individual spots that I really want to hit hard, whereas I think of the IPL as more of a global tone treatment. But I can use the Pico in Asian skin to do an all over fractional Pico treatment, which does give really nice background kind of toning and evening effect.
I have had patients say they've had liquid nitrogen.
Mhm.
So when does that come into place?
I like to use liquid nitrogen when my patients have the kind of age spots that are not actually sunspots. They're very, very thin, but very slightly raised. We call them macular seborrheic keratoses. And sometimes you don't recognize them until you've cleaned up some other things with a laser treatment. And it's usually those raised structural ones that I will zap with the liquid nitrogen.
If I feel any texture to the brown spots, then I think of it more as a growth versus a sunspot. And in those cases, we'll do something like a liquid nitrogen. What about peels, chemical peels for these spots?
Chemical peels are great for pigmentation and for sunspots. Superficial chemical peels may not get people the results they're after. So oftentimes a medium depth chemical peel is necessary. Some of my patients are a little nervous about chemical peels compared to lasers. Lasers just seem maybe better controlled, but the peels have been around forever, can be very, very safe in our hands with training. And sometimes it's nice to do just spot chemical peels on individual areas. I know that's something you're a fan of doing.
I love doing that, especially like sometimes even after an IPL, I may spot treat them with a little bit of a medium depth peel. I also love like what you said. I love doing our IPL and then doing a little light ablative or fractional laser afterwards. I think you get amazing results because you're also not getting rid of just the photo damage, but you're also helping with some of that crepey skin.
What lasers do you like for our Latina patients or Southeast Asian patients with darker skin tones when they have pigmentation?
One of the safest lasers that you can use for that skin type is our clear and brilliant laser. I love the clear and brilliant laser. There's very little downtime and it can help with pigmentation and also can make your skin look glowy and people like it a lot.
Well, thank you. That's a terrific introduction to sun-induced pigmentation. I know we're going to follow up on another kind of pigmentation, melasma, in our next
Yes,
episode.
stay tuned.